Pleasure.
Let's see, time now is 7:48. Care home staff worked extra hours unpaid to support the struggling system during the pandemic, a study has found.
Now, the report led by Warwick Business School says that government funding helped to stabilise businesses during the first COVID wave, but was withdrawn too quickly and didn't benefit employees. Our social affairs editor, Alison Holt, has been taking a look.
So give the farmer a spot, he'll get by. He'll get by without his rabbit farm.
At St Prelade's care home in Kent, life for residents like 89-year-old June is back to something like normal after the toughest of times during the pandemic.
Run, rabbit, run, rabbit, run, run, run.
Marvellous, well done everyone.
And it was the extra hours put in by staff that helped many care homes survive, according to today's report. Here, care workers actually moved into the home.
I lived here for 3 weeks, but then I was in every single day after that for another 4 weeks, I think. I drove myself here, drove myself home, changed my clothes, reduced the risk, wore a mask when I was out, didn't communicate with anybody, like pass anybody or anything like that.
With the public, we had more support and more praise. There was a clap every evening, whereas now I feel like everything's moved back to normal and it's kind of been forgotten of how much carers did and how much we had to sacrifice.
The study by the Warwick Business School and the Centre for Health and the Public Interest found nearly 2/3 of care homes went into the pandemic financially fragile. It says an extra £2.1 billion of government funding prevented the sector's collapse, but not all of that reached the front line. It points to limited change in staff pay despite their extra hours. The report also says more than 100 of the largest care companies increased the money they paid to shareholders.
It is pretty concerning that the money that went into the care home sector didn't in all cases go to the front line. It's also the case that there were lots of other care home companies and also charitable companies that were doing their very best in order to ensure that they maintained high levels of care and also sought to do their best to treat staff appropriately.
And the majority of care home companies are small, like St Prelade's. Here, the owner says they worked hard to support staff and residents. Extra government money eased pressures during the first year of COVID, but it's been financially tough since that help was withdrawn.
Inflation really kicked in. Everything had become much more expensive. The energy crisis had happened. So you had now less revenue, less subsidy and high expenses.
Since the start of the pandemic, at least 3 care homes have closed locally. There are plans to turn this one into flats. The report says there needs to be better understanding of care home finances and an improvement in staff pay. The government has said it is providing extra money and has set out plans for reform. Alison Holt, BBC News.
Now, one of the most